Hi everyone, my name is Olivia Lobalbo and I'm here with A.E.R.O Animal Rescue, and today we are going to be going over the very basic exam that you're going to be giving the wildlife animals that are coming in from the wild. Today we're going to use a mock animal for one of the exams, and then I'll bring in one of my real animals. It's kind of fun to actually put eyes on the animal and see how we're doing this. A physical exam is really important. It tells us a lot of things, you know, injuries, illness, things that we need to know to treat going forward. But it also tells us the very basics of this animal, like the gender, the age. It's going to help us to know, has this animal eaten recently? We're going to get a base weight so we know how much to feed, how often to feed, etc., etc. So let's start with supplies. This is our little example dog today, so he is a member of our supplies. But what we really need is a piece of paper and a pen. That's always a must for supplies. A stethoscope. You don't need anything fancy with a stethoscope. Unless you're an actual veterinarian or a cardiologist, then buying something cheap, Amazon, easy peasy. Usually they have a smaller head. It's called a bell, and they have a neonatal bell. And getting that is probably a better idea. Having one of those on hand, that way you can listen to the smaller animals. We're actually using it to listen to a lot of lung function more than you are a heart. 9 times out of 10, if it's small mammals, your heart rate is going to be so high you can't count it anyway. If it's a reptile, you're going to have to get a Doppler out to really get a good heart rate. And, you know, it's just a lot of listening to the lungs to make sure there's no crackling, things like that. So any stethoscope will really do. The next thing, very important to have, is gloves. No wild animal should you be handling with your bare hands. I know everybody always says that, glove up, but you know, you really gotta glove up. Some of these animals have crazy things like viruses and intestinal parasites, and the worst thing you wanna do is touch them, end up wiping your eye, something like that, and then you're sick. Having a pair of hemostats on hand is really nice to have in a little collection container. I do this, especially with my reptiles, especially the turtles that come in. I end up pulling out fish hooks out of their lip, maggots out of the shell, botflies out of the squirrels, you name it. We have a little jar for it. Ticks, pulling ticks off and putting them in alcohol is a good way to kill them and just get them out. This is another one. You can buy a cheap version off of Amazon if you like, but just a little pin light to be able to look into their eyes. And we'll go over why we're going to look into the eyes in a few minutes, but just to have that on hand, it's very good. You know, your cloth to put down. So we're going to set up a little station here, which I'll take a picture of and post it in here. But you're going to set up the cloth just in case anything drips, anything gross, you know, your animal pees, whatever. You have a little station. And a scale. Scale is very important. The number one thing that you're going to get, if nothing else, is a weight. So that's the supplies we really need to get started. And once I get all of this together, we're going to do our mock exam. So let me take a picture and I will start the next video. All right, so I did a little picture of our setup here. It's kind of hard to videotape it because I'm on a tripod, but just so you guys get an idea of what all is involved in this, we got our setup, we're good to go. Now we're gonna get started on our exam, okay? So here's our patient today. I'm using a mock patient first because I wanna explain as I go, and then I'll do an actual exam on an actual squirrel baby. And the reason I'm using a baby squirrel is because I never wanna talk during an exam. I don't wanna stress them out. I don't want them to feel any more involved with humans than they have to be. But an eyes closed baby squirrel kind of has no idea what's going on anyway, so I can talk a little bit more, and I'm not going to risk imprinting or scaring him to death or anything like that. So what I'm going to do today, let's get everything ready. Here we go. I'm going to prep all of my stuff before I ever take this animal out. The reason we do that is the longer we handle them, the more stress that they're under. So we're going to limit the amount of exposure time as much as possible. We're going to have all of our supplies ready. We're gonna have our pen and paper so we can write all of this stuff down. And we're gonna keep this exam under 2 minutes. Very important for any animal. This is not a teaching moment when you're doing an exam. I've noticed that a lot in clinic. You know, you have something come in at a companion animal clinic, The doctors want to do an exam. That's fantastic. We're so happy. But during that process, this animal is alive and they're like, oh, but look at the broken arm here and look at how it's not aligning properly. And you know, these animals are in pain. They're terrified. If those are the cases, then euthanasia is the best course and then doing the teaching moment, or waiting and talking about it afterwards. Very, very important, especially with wildlife. It's not like our cats or dogs who are just comfortable with us handling and manipulating them. This is a different animal. All right, so we're gonna get started. In step one for any exam, just in case this animal panics or something happens, somebody rings your doorbell, the first thing I want you to do is pull them out and get a weight. We're gonna look at it. The weight should be in grams when we're doing anything medical. Finding your weight here, make sure it tears out first, meaning it goes to 0. You pop them on. My patient weighs 49 grams. Fantastic. I'm writing that down, 49 grams. Now, if nothing else happened, I can put him back in that cage, take care of an emergency or whatever just happened, and at least I would have the weight, which is so important. That tells us a lot about the age, the condition, what to feed it, what to do going forward. All right, so we got a weight. There were no emergencies. Let's keep going forward. We are going to conduct this exam from the tip of the nose to the tip of the tail. Again, you're going to handle this animal with safety measures in place. I mean PPE. If this is an adult raccoon, you know, I'm not going to be like, oh, hi. If this is an adult squirrel, I suggest sedation if you can. Squirrels are notorious for waking up and being totally fine and freaking out. They bite, they run, they hide, they get into places that you can't get them out of. Take my word for it, sedate for exam when it's an adult or squirrel. Other than that, let's say this is a baby squirrel, easy peasy. Maybe a possum, something like that. You can generally get away with doing an exam without them being sedated. It's important to also get a visual on how they're behaving before you sedate. Obviously, if you're sedating, you're doing that in clinic. You're not doing that as a home rehabber. But either way, putting eyes on the animal and seeing how he is acting. That's your basic for any exam. Imagine that you're a pet owner and you're coming in and you're just telling the doctor, hey, this is what I've been noticing. That is that first information that we need. So you're gonna look at him in the cage. He's in a cage right now and you're like, oh, he's a little bit lethargic. Oh, he can't use his front legs. Oh, whatever it is. Write all of that down before starting the exam. Now we're starting this exam here and we're gonna go tip of the eyes, tip of the tail, and we're putting hands on him. Here we go, 2 minutes and under. And the first thing that we're gonna do is look for any obvious injuries. I see that my dog chewed off part of its nose. That is a problem. So, tip of nose is missing. Write that down. I'm also looking fur is matted. Fur is very matted. He's been in my dog's mouth quite a bit. Tag is chewed up, possibly missing portions. He is tipping over forward to the right. Whatever it is that you're noticing, obvious issues, blood coming from the nose, wheezing, lethargy, write that down. Then we're going to examine just overall face. Now, when you're doing an exam of the face or the entirety of the body, you want to look head on. You want to know that this eye is the same as this eye, and this side of the face is the same face shape as this side. You want to see that everything is kind of bilateral, and if it looks like this on one side, it should look like this on the other. And when it doesn't, that's a good indicator that something's wrong, such as, there's a lot of swelling over here. You won't be able to tell unless you're comparing the right to the left, right? So looking at it dead on and saying, okay, your eyes are both the same. Your mouth, I'm opening it up. Teeth look the same on both sides if you can get the mouth open. Do not stick your hands in their mouth if this is an adult animal. Any animal with a mouth can bite. Looking in the ears, we want to make sure that there's not any gunk, no blood coming out, no foreign bodies, nothing like that. And then we're going to just, as a whole, note any, again, nasal discharge, eye discharge. Sometimes you look at the eyeballs itself and they almost look blue or glazed or like a white film over them. That's a sign of dehydration. You want to write all of that down and you want to do it quickly. So again, doing this quick exam, you're really being invasive to this animal right now. They're uncomfortable. Let's get it done. I also have this handy dandy little mirror magnifying glass thing that I like to use. This way they don't see my face as clearly, so they're not quite, as threatened. And I can also get a closer eye view of what's going on with the face and any other parts. So once we do the face, like I said, general impression, we gotta wait. We're gonna look at the body as a whole. And what we wanna do is look for the body condition. And when I say that, I mean, imagine that you're on a scale of 1 through 10. There's many different scales that different centers and veterinary offices use. I'm gonna use 1 through 10 to dumb it down for you guys. 1 being absolutely starved, emaciated, on death's doorstep, probably not gonna make it. And 10 being morbidly obese. I don't know how he's made it this far. He has diabetes. Okay, so you want him to be at a 5, just right in the middle, a little plump, not too skinny. It looks like that they've been eating, they're healthy. And if they're not, we need to note that. And you're gonna note like hip bones sticking out, or if you can see the spinal cord, especially in little babies and neonatals, they miss a couple of meals and they just start to drop weight, and you're gonna be able to see the ribs. We don't wanna see a huge waist on a baby, but an adult can have a little bit of waist. Sometimes they say, especially with the foxes and some of the bigger mammals, you want to be able to see the ribs, but you don't want to be able to count them. Little things like that. You don't want to see any pressure sores on any of the spots, like they've been laying down too long, or with our mangy foxes that come in, they just have these like sores at every corner. Anything like that, again, you're writing it down, you're noting it. If he's cold to the touch, especially with our babies, that's important to note. In fact, you might even want to put a heat pad underneath your exam blanket, just so that while he's sitting there, you can keep him warm. Some of these animals are coming in from really cold temperatures, or even in the middle of summer, they can't hold their own temperature. They're babies, that's why they have a parent taking care of them. You find them on the ground and they're not able to keep that body temperature up. It's really important that you provide that heat. So now we've done the eyes, ears, nose, mouth. Now let's take a look at each leg. Palpating the legs as we go is really important. So every animal that you're going to examine, and this every mammal, actually, I should be very careful what I say. Imagine this is the baby squirrel and not a bird, but you want to be able to manipulate these little limbs. You want to make sure that they move the way that they're supposed to move. Knowing the natural biology of these animals and anatomy and physiology is really important, because you need to know how to extend a bird's wings and take a look at what's natural, what's not. You want to know how these guys should be moving their back legs, how they should not. You should be familiar with them moving in a healthy manner. Sorry, let me move this out of the way. Any of that stuff we just want to look at. Now, if you're palpating this right front leg and you feel something kind of crackly feeling, and then all of a sudden he's like, ah, okay, well, that's probably a pain response. So we're going to say, ooh, right front is sore. So that's good to note. We're not going to address it right now. We're not going to place it. We're not going to do an x-ray. That is just something we're writing down. The diagnostic portions and the treatment portions can come next. Also, when we're looking at this, we're going to palpate down the spine. And the reason we do that is because if they have neck injuries or back injuries, it's really important to be able to feel for those and take those into consideration as well. We don't want them to have a back injury and then it isn't until we've been taking care of the squirrel for 2 weeks, he's opening his eyes, he's starting to move around, and we're like, oh, he can't use his back legs. Well, that's something that we could have caught early on, and it's happened before, it'll happen again, but sometimes these things get overlooked, and then you find out you have a squirrel with broken back legs, and you have to euthanize. And it's really a shame that, you would have wanted to know that right away rather than putting the squirrel through this and putting you through the rehabilitation process. And then lastly, we're going to flip them over and look at the tummy. We're going to do the exact same thing. We're going to kind of feel the tummy, make sure it's not hard or it can be squishy and swollen, that's fine, because especially with our baby bunnies, they come in looking like little Buddha bellies. But we don't want them to have any bruising. A lot of the times, and I'll show you on a different animal, we have an example where it's just like almost like a marble, it looks like, and that's the bladder. So we know they have a really full bladder. We could tell sometimes a milk line on some of these babies, and we can know, oh, well, you have a milk line, that means you've been fed recently. Really important. We get these animals in from a person from the public who's like, oh, I've had him for 2 days now and mom never came and I swear I haven't fed him anything. And then I bring him in, he has a big old milk line. I'm like, what have you not been feeding him? I need to know. Very important. And then you want to look at the genitals as well. You want to make sure that nothing looks red, swollen, angry. You actually want to check and make sure that there's no crusting on it. There's no fly eggs around it. Be careful of that, especially with the little neonatal babies. and get all of that cleaned up. Again, you're gonna have to stimulate them to urinate and defecate, so you're gonna clean that up anyway, but just getting a good eye view and seeing that everything is clean and not angry looking is really important. Also, being able to tell the gender is kind of important. For instance, bunnies, I won't necessarily sex them during an exam. It's just to check and see how everything looks. But on a possum or a squirrel, I could be like, oh, it's a baby girl, you know? It's nice to kind of know that information. Make sure nothing's discolored, nothing's swollen, all of that good stuff. And then the last thing we're gonna really try and test really quickly is called a turgor test. Most people have heard of this. It's like tenting. So I'll do an example on my own hand. You want to be able to pull up the skin and boing, it goes right back into place. Boing, it goes back into place. If it's not boinging back into place and it's staying in a tented position, that usually is a sign of dehydration. That's not good. We want to reassess hydration afterwards and come up with our treatment plan based on that information. All right, so let's do that little exam one more time. Boom, boom, boom. I'm looking. He looks good. I'm gonna pull off a little maggot around his ears. There it goes, it's in the container. There are certain animals and procedures where your vet might tell you to deworm on intake. There are certain species like baby raccoons that we deworm on intake, working with our veterinarian. That's between you and your veterinarian to kind of come up with a protocol and plan for that. But now would be the time to do that really quickly, as long as everything looks good and you're planning on moving forward. And then you want to put that animal back into the box, cover him up, and keep him calm and quiet while you come up with a treatment plan. All right, I'm gonna go get our squirrel and we are going to do a real exam on an animal who literally just came in 40 minutes ago. Just a second. All right, here we go. So again, when you're doing the physical exam, normally, no talking, quiet is key. I am gonna talk a little bit as we go through. This is a baby squirrel, he's a little bit more chill. Here's what we do know is that the finder found him last night next to a deceased sibling. She did try reuniting, it didn't go over well. She tried to give some Pedialyte and some kitten milk. He didn't take either of them very well. I don't know what that means, whether he just rejected all of it, usually they do, or if he might have had a couple of drops. Regardless, we're gonna kind of get an idea for what's going on. So he's in this stable little nice place, and then I'm gonna pop him out. The first thing we're gonna do, again, is get a weight on him. He is definitely a little boy. Say hello. We're gonna get a weight. He weighs 50 grams. And right off the bat, I'm noticing something about him. He is tilting his head to the right. That's not normal. I'm not sure if you could see this or not. So he's almost kind of tilting over like this. And that can be a sign of some head injuries. All right, I'm already noticing something else as well. If you look at the eyes, this eye compared to this eye, the left one is much more swollen than the right eye. That is a sign that there is, something going on with that left eye. So let's write down left eye swollen, head tilt. Okay. Let's look at the rest of him. His mouth is clear, his eyes are clear, his nose is clear. Let me get a listen. His lungs sound clear. I can hear a very good heartbeat. That's a good sign. Again, I'm going to palpate here a little bit. Does anything feel painful? I almost am going to say that he is a little bit painful on his cervical spine. And this is the kind of case where it's time to bring in a vet, because I don't want to cause him any unnecessary pain by continuing to palpate, and she's going to have to do it again anyway. But I can say, I think he's a little bit sore. Does he have 5 toes? 5 toes, 2 legs. Legs look good. No swelling, no swelling. Belly. The belly looks good. We're not actually seeing anything crazy on the belly. A little underweight, but nothing terrible. You can see that dark marbling there. That's his bladder. Obviously, he's a little boy. If you have to ask, it's a girl. That's my rule. You can always tell a boy. If you have to ask, it's a girl. And his tail is straight. Everything else looks really good. My only concern really is that swollen eye and the head tilt, and possibly a little bit of pain up in that spine, which, I'm just not going to continue to aggravate. Everything else looks good. We're going to do the turgor test now. We're going to pinch him, And you see how it stays kind of wrinkled and tented. Sometimes you'll still get that a little bit with even a healthy baby, but not to this extent. So he's a little dehydrated as well. Not uncommon, not unexpected when he's coming in after being away from mom for so long, for any amount of time really. But we're done. So now we have all of that information and we're going to present it to our vet and say, what next? They can make the final decision as to whether this is a good candidate for rehabilitation, or maybe we should continue to think about medication and watching him, coming up with a treatment plan, or sometimes are we going to humanely euthanize because we don't want to put an animal through all the pain that has to go through and the stress of rehabilitation. So I hope this was helpful. I hope you learned how to do an exam, and if you have questions, reach out. Thanks.